Good afternoon, I'm John Van Hertwood from the Natural Life Clinic in St Catherine's. I'm here today to talk about lateral epicondylitis and medial epicondylitis, or as more commonly known, tennis elbow and golfer's elbow. I'm going to talk today about some of the causes, what's going on kind of on a local level in there, and how to do a few things at home to try and improve it. So, let's begin by talking about what's kind of going on there. Both the outside of the elbow and the inside of the elbow are very important attachment points for the muscles. We have the muscles that do this, so these are flexors of the wrist and hand, and the ones on the outside as the extensors. Now what can happen is these muscles are engaged in a sheath of what we call fascia. This is connective tissue. It's very similar to the membrane you get on the outside of a chicken breast. So not the skin, but the thinner membrane. Now what can happen is, if we're doing a very, very repetitive type of motion every day, whether it's through sport, housework, or your occupation, what can happen is that muscle keeps getting engorged because you're trying to obviously use it, but unfortunately the fascia, so the connective sheath around that muscle, is unable to expand at the same rate. So what happens is we get some irritation off these attachment points, and you get small micro tears. Again, with micro tears you get some inflammation, and with that inflammation comes more kind of swelling, and as I've just mentioned, that we can sometimes be a bit unlucky and the connective tissue surrounding the muscle is unable to engorge and allow that extra inflammation. So this can cause some very localized pain. Often it can either be with movements which are doing that, or like I said, if we're doing movements like that under any load, you can often feel the pain either in there, or like I said, on the outside of the elbow. So there's a few things we can do at home to even try and get some relief. The first thing is, if you get a chance, to give your body a break. If it's something you know you're doing every single day, if you're a carpenter and you're hammering away every single day, then unfortunately that's just going to predispose you to these types of conditions. So if you can give yourself a break, obviously it's quarantine time for lots of people at the moment, so it can be an ideal time to get on top of some of the ailments you may have. Rest is one of the key things to begin with. Rest from whatever the aggravating factor may be. Now, the next thing we can do is we can do some nice and gentle cross-fiber techniques. So, if it's the pain's mainly more on the outside of the elbow, we want to just start there and gently kind of run our fingers over in a crossward manner from the muscle fibers that are going that way or working in the opposite direction. Okay, and once we've done that, you can then begin to work longitudinally, so we're kind of going with the muscles there. So the first one is we're trying to break down some of those tendons and those kind of knotty, gritty little bits, and again, the same with that connective tissue. And we're trying to do that way, and then we can kind of go lengthways, where we try to then lengthen those fibers, lengthen those tendons. You may find a little bit of baby oil, body lotion, even a bit of coconut oil or something like that may make it a little bit more pleasant. So you can just give yourself some gentle self-massage. As I tell all my patients, it's not a no pain, no gain type of situation. If it's uncomfortable, don't think you're pushing harder and deeper and it's going to help it. As I mentioned before, there's inflammation, irritation that's compounding the issue. So if you go further than that, it's not going to be of any benefit at all. So nice and easy, just gently work it. You'll be able to push your stomach, you should be able to feel the different muscle fibers. You can almost separate them where one starts and one finishes, and if you can kind of work in between them, just to open it all up. Okay, and again, if we're doing it on the opposite side, you're going to get just gently go crossways. You can ask your partner to help, and you can do that, and then we can come lengthways. Okay, there's a couple other good stretches we can do. So nice and easy, if we're trying to stretch out the tendons on the inside of the elbow, just keeping the stretch. What you can do is you can tweak kind of the angle of the hand until it feels like a more effective stretch. And again, it's not a no pain, no gain type of thing. You can just sink into the stretch, breathe in, breathe out. And for a stretch to be effective and actually have long-lasting results, you really need to be holding it for around 30 seconds. Another thing you can do is if you have any tables or chairs or something like a sofa, you can rest your hand on it and kind of lean into it, and you'll be able to kind of find a point where you'll be able to feel that stretch. So you can either stretch it that way, if it's for symptoms on the inside, or you're going to be stretching with the back of the hand facing downwards if you're trying to stretch pain on the outside of the elbow. And again, you can just kind of hold it for around 30 seconds. And like I said, a little bit of pressure down there. Like I said, the edge of the sofa can work well, or a table with just a pillow or something softer underneath it. And you can just get a bit of compression. And again, breathe into the stretch, breathe out. And that's going to just begin to elongate those fibers, elongate that connective tissue surrounding the muscle. And then with the massage which you would have done, it would help to get some blood flowing, to actually help to get some general localized healing in there as well.